no country has ever developed without investing in research. And therefore, we look forward to CNHR continuing to support research for health in Kenya to address the many challenges and emerging diseases.
The grant has made a difference to myself as a person in advancing my career as a research scientist.
People do not have answers to some of the ailments that affect the citizens. Why? Because we do not have the infrastructure to answer the question.
There is a saying that goes, a healthy nation is a gateway to a healthy economy. At Kenya's independence, the young government went all out to fight poverty and hunger, ignorance and disease in order to escalate meaningful development. As from 1963, the government of Kenya has worked tirelessly to provide quality healthcare for the close to 40 million people, majority of whom live in rural areas. Since then, a lot of effort has been put together to consolidate appropriate health research for quality healthcare for all Kenyans. At the turn of the millennium, the health sector started to grapple with a persistent high burden of diseases like malaria, HIV and AIDS, and tuberculosis. And not only that, Kenya, like other countries in this region, faces an emerging chronic disease problem characterized by increasing rates of cardiovascular diseases, cancer and diabetes, among many others. As such, in the past 2 decades, life expectancy has declined to 53 years and mortality among children under the age of 5 has risen slightly, raising health challenges to a new level. To normalize the situation, the government is working closely with research stakeholders and partners to bring forward evidence-based and informed health policies that will lead to quality healthcare service delivery for all Kenyans as enshrined in the Constitution and the health pillar in the Vision 2030. One such stakeholder is a consortium for national health research, CNHR, who has been working with partners to improve the quality of health in the country through promotion of quality research, encouraging the practice of evidence-based health policy formulation to improve healthcare and its delivery, building the research capacity of Kenya's talented youth, and the creation of functional strategic partnerships.
The mandate of the Consortium for National Health Research, CNHR, is really to support Kenyan researchers to undertake relevant research. In other words, research that address priority health issues that have been identified or affect the majority of Kenyans.
Since 2007, when it was established, CNHR has brought together key players in health research, the aim being to address a broad spectrum of issues affecting health research, including prioritization of research activities and coordination of the same, training researchers, strengthening the legislative environment, and enhancing the sharing of knowledge in order to strengthen the capacity of health research nationally.
Within the consortium, one of the strong members is the Ministry of Health. The Ministry of Health is not only represented in our council of members, but the Ministry of Health is also represented in our board of management. And that's one way of aligning our activities with the ministry's strategic plan.
So we look forward to a very expedient research process, and as soon as you are able to, please get back to us so that we can sit again, so that the leaders who are here today will be very keen to hear. Very keen to hear. I'm sure they will even bring more people with them to hear about these outcomes.
Apart from the Ministry of Health, the consortium is working closely with health institutions, universities, research institutions, government agencies, non-governmental organizations, and other research groups concerned with health in Kenya.
As a researcher, one of the things that helps you develop and also gain experience is the studies that you're able to do, providing evidence that may inform policy, either here in Kenya and even in Africa, where we have malaria, and of course we have pregnant women who need appropriate treatment. The grant has made a difference to myself as a person, something that has enabled me develop myself as a scientist.
Health research provides basic information on the state of health and disease in the population. It also provides tools to prevent and cure illnesses and investigate their effects. Such efforts are beneficial to individuals and communities in their fight against diseases that would otherwise, if left unchecked, impoverish them.
Umano, kijende madhenamge. Nitie samoro sipna. Mawuoyi mobedo gachiel. Yie modhi nam nyaka ngadhi ma yude rech. Nikech wabedo ga kode achiel. Mano miyo nyaka ngayud rech e yien. Kendo adhi ka jachir. Mokwongo alwora mar dho nam ka wuoyo gi ng'ato modhi e pim tek. Kata chaka wuoth mar ng'ato nodhi e pim tek. Unubiro muwuoyo kodgi mos ma wadhi e pim. Koro nyaka wadhi e pim naneno ka nikech koro miyo koro ng'eny ji koro ng'e kaka gichalo.
From this grant, we were able to conduct research on extramarital partnerships. That was a big issue in the fishing community. And extramarital partnerships is one of the key factors in HIV transmission. So we did research, we completed the research, and we have since shared the findings of our research with the community.
The Consortium for National Health Research, CNHR, has established various programs to this end to answer to the need of quality research. The consortium offers young graduates internship programs where they are exposed to modern approaches of scientific research as they gain first-hand experience from performing scientific procedures with the aid of varied sophisticated analytical or diagnostic equipment. This is done under very close mentorship and supervision of senior research scientists.
Research internship is really the beginning. It's an opportunity to identify youngsters, fresh graduates who may be interested in making research a career, to work in some research environment and make an informed decision.
10 grants are competitively awarded every year. The objective is to enable the interns to make an informed choice on research as a career option. Since 2009, the Consortium for National Health Research has supported 40 interns in various research-related projects.
Late 2008, there was an advert on the print media that was a call for young graduates to apply for 6 months internship by the Consortium for National Health Research. I responded to the call. I applied. Based on my background and the work that was happening at the Kombewa Clinical Research Center, I was posted here as my workstation for 6 months. But once I got here, I got very strong mentorship from my mentors and supervisors, as well as colleagues who were very supportive and patient with me.
CNHR has also supported research institutions to undertake high-quality relevant research and upgrade research infrastructure. 5 research leadership grants have been offered since 2009, targeting senior researchers who provide mentorship to the upcoming researchers.
There are international standards as with regard to how should you house animals. When you put them in pairs, what space should they occupy? Now, IPR is trying to modernize its facilities. The investment required to get there has been huge, and that is why CNHR support. In terms, so CNHR came and said, you can use part of your money that we have given you for this grant to actually put up a new animal housing facility that meets international standards. And if you go to IPR, you'll be able to see that facility and see what has been done with that regard.
Working closely with partners like AMREF Center for National Health Research, CNHR has ventured into the vast areas of Turkana, seeking to address the health challenges to the population of about 860,000. Appropriate data collections from the few health centers in the vast region is helping the county government and the national government address some of the pressing health needs, like the need for skilled birth attendants. Another program area is a research training fellowship linked to the Research Leadership Grant Program. So far, CNHR has supported 8 research training fellowships, among which 7 PhD trainees and 1 postdoctoral fellow were trained. The training is also done under a CNHR-supported mentor.
But if you're having a discussion, an explanation for that discrepancy. That's good enough.
Interestingly, I came to learn about the grant through the web. It was advertised in 2009, and while I was working in Saudi Arabia and a company known as Arabian Agricultural Company, I came across the advertisement, and on inquiring further, I was informed that indeed there is a call for students on PhD programs who are interested to start their PhDs as early as October of 2009. So I thought this was my eureka moment to come in and try and do my PhD.
With this PhD training, it opened me up to many other opportunities that I would not have otherwise been able to do. For example, during my training, I was able to apply and get other grants. And were it not for this CNHR grant, it would have been hard to get these other grants because it trained me, it gave me the individual perspective.
So I bought the equipment, I brought in a PhD student and some human resource support, and I started doing work. What happened was that other collaborators or people I had worked with before had, because I told them, that I had gotten some money from the Consortium for National Health Research, and I had been struggling with them to give me some funding or to get some funding together. And they said, let's go and see what it is that you are talking about. And when they came and they found that I had even polymerase chain reaction equipment, I had centrifuges and so on, they said no, they could give me money to do research work.
And it doesn't stop there. A research career development grant program targeting researchers based in Kenya or those willing to return from the diaspora has been up and running. Those targeted are mid-career basic biomedical or clinical researchers and senior postdoctoral fellows, particularly female researchers, and public universities. All these are linked to the CNHR-supported Centers of Research Excellence (CORE), where researchers can access state-of-the-art pieces of equipment for research. Since its foundation, the number of postdoctoral fellows has increased from 1 in 2009 to 8 by 2014.
As a young person, I felt the need to come back home and start the career as well. Secondly, the CNHR offered a platform where I could transform from an animal health scientist into a human health scientist. So that also brought in a new aspect because arthropod-borne viruses cross-cut between animals and humans.
When he came into the room and answered the first 2 questions, I relaxed and knew this is the candidate you are looking for. The rest of the time I just spent filling in the gaps. This has been probably one of the most successful PhD students I've ever had, or anybody has had for that matter. Very focused, very intelligent, finished his PhD in 3 years. So now we are working, not now as a research leader and a PhD student, now we are working as 2 scientists collaborating, me and him.
Use of the concept of Centers of Research Excellence (CORE) is a unique feature that ensures an integral involvement of government through the Ministry of Health to facilitate the research to policy and practice linkages. There are 4 such centers in the country. One of the centers is piloting the delivery of the community health strategy within a peri-urban rural setup as well as marginalized nomadic setting. The other provides essential postgraduate operational research training for health researchers, including doctors.
There are 4 independent institutions that have come together to form this consortium called CREATES. These are the Strathmore University and the Kenya Medical Research Institute as another partner. We have an international partner from South Africa called the Council for Scientific and Industrial Research. They are one of the partners. And then we have a local NGO which I come from called the African Center for Clinical Trials.
CNHR also contributes to the building of vibrant networks and supporting communities or centers of research excellence that are able to offer an environment for sharing of resources as well as provide research-rich career paths to young scientists, thus retaining and enabling them to become internationally competitive in the generation and use of health research evidence.
Good morning, everyone. This is our normal program management committee meeting.
The collaborative linkage between research actors and policy makers has provided an innovative framework for addressing complex health system challenges by breaking institutional barriers and avoiding unnecessary competition while allowing for more efficient resource mobilization and utilization. The centers are now delivering outcomes that positively impact on maternal and child health, as well as providing capacity strengthening for the next generation of researchers and policymakers.
We have researchers, both in public universities and private universities, from the research institutions, from health NGOs, and we have strategic partners. So Kenyatta National Hospital, Moi Teaching and Referral Hospital are our members. So, and right now we have the current funders, the DFID and Wellcome Trust. They don't just give us money. They are involved in the activities.
Working closely with the National Commission for Science, Technology and Innovation, NACOSTI, Ministry of Health and the Ministry of Education, Science and Technology, the Consortium for National Health Research brings together annually stakeholders working in the health sector to meet and review progress of implementation of research for health activities. The other area is Research to Policy Dialogue Forum to help in key areas of strengthening the regulatory framework for relevant, high-quality and ethical research for health, and supporting researchers to undertake relevant priority health research to inform policy and practice changes.
Even if I stopped doing research right now, I would still be writing papers 5 years from now.
I see myself helping future scientists develop their career.
I would also want to have an opportunity to be an independent researcher and also mentor and teach others.
The dawn of a new day in the health sector has beckoned. CNHR will not rest until there are enough scientists to do appropriate evidence health researches to answer to the growing need for quality health solutions in Kenya. For this, they are determined. Health research for quality healthcare.